Good morning, Anna Marie. Thank you so much for taking out the time to be here for this 50 minutes intake assessment. My name is Thelma J, and I'll be supporting you through this intake process. And if you have any question at any time, do not hesitate to ask me, okay?
Okay.
Okay. And before we proceed, I would like to explain a little bit about our confidentiality policy. And I want to assure you that your confidentiality is important to us, meaning every information you share with me during this session will be kept confidential and only stays within this room, except in certain situations that is outlined by law that places you at risk of harming yourself or others. An example of such circumstances include instances like abuse or neglect, and a court orders requires that information to be disclosed, which will breach your confidentiality.
Okay.
But other than that, every information you provide me is protected, except you give an authorized person to have access to your record.
Okay.
Does that sound good to you?
Yes.
Okay, good. Um, if you don't mind, if you could kindly sign the portion of the form that says, I have read and understood the boundaries of my confidentiality policies.
Okay. I see.
Good. Also, I want to encourage you to ask any question at any time. Um, and the next set of questions I'm going to ask you is about your physical history. So I'm going to ask you this question since I have a copy of your initial assessment form. So your name is Anna Marie Rees. Is that correct?
Yes.
Your physical address is 95 somewhere street.
Yes.
Is that right? And
Sorry.
your date of birth is August 1, 1980. Is that correct?
Yes.
Okay, great. Thank you for that information. And I want to assure you that our conversation here is between us and is confidential. And what you share with me, it just stays between us.
Okay.
And I'm here to listen without judgment and support you in exploring your experiences. Okay?
Okay. Yeah, I will say I'm a little nervous about coming to a therapist for this issue, but my doctors have recommended, so I I feel comfortable talking to you so far. I appreciate it.
Good. Thank you so much. Thank you. So I'm going to ask you a few questions. And the first question I'm going to ask you is, are you currently taking any kind of medication?
Just medicine for allergies, like a Zyrtec and Singulair.
Okay, great. Are you currently seeing a medical provider?
I am. I am seeing a urogynecologist and a pelvic floor therapist for my pelvic floor dysfunction.
Okay. So have you ever undergone any type of surgery in the past?
Yes, I've had several surgeries. I've had a breast augmentation, I've had a gallbladder removal, and I had a partial hysterectomy.
Okay. So are you currently experiencing any symptoms like headaches, um,
Sometimes.
loss of appetite?
Here and there, I lose my appetite. Yes.
What about dizziness?
No, no dizziness.
And what about bowel disturbance?
Yes, yes, I am having problems with that.
What about are you um, depressed?
I, sometimes I feel a little depressed, dealing with some of the issues I've been dealing with lately with my pelvic floor problems have been kind of affecting my relationship with my husband.
Mm. Do you feel fatigue?
Um, Sometimes, and I don't know if it's with because kind of feel down and depressed, I'll feel a little extra tired from time to time, but nothing debilitating.
Okay. What about anxiousness?
Um, yeah, I do get a little anxious when I because I kind of worry about some of the physical issues I'm having. So yes, I do.
Okay. What about insomnia and stomach troubles?
I definitely have the stomach trouble because I have some bowel disturbances. And then sometimes I can't sleep. It just depends on if I'm feeling anxious about some of my issues, and I sometimes can't sleep well.
Okay. Thank you so much for providing me that information. So, since we have completed filling out the forms regarding your family history and sexual experiences, would you like to tell me what brings you into our office today?
Well, as I was saying, I'm having some pelvic floor dysfunction, which is greatly affecting my sexual relationship with my husband. I'm having pain with intercourse, I'm having some vaginal dryness, um, unable to achieve an orgasm. And I spoke with my doctor, my pelvic floor therapist, and they really recommended that I come in and talk to somebody about the mental side of this.
Good. So, what feelings do you have about sex?
Um, well, I would say I have like good feelings about it. I think it's a something that my husband and I was it was a very strong attribute between us. But since I've had all these pelvic floor issues and these pain, it's becoming something that I dread or I'm not interested in because of the issues, the pain and the dryness.
Okay. So, how does sex make you feel?
Well, it used to make me feel good. I know I keep saying used to. I had a lot of good experiences, but now that I have again all the physical problems, now it's making me not enjoy it and feel anxious about it, or I feel also like feel bad that it's affecting my husband as well because he knows that I'm in pain, so we both can't enjoy it like we used to.
Okay. So, does it kind of make you anxious,
Yeah,
depressed?
it kind of makes me anxious, like leading up to it, knowing that I'm probably not going to feel good, and probably not as much, maybe a little sad, probably not totally depressed, but yes.
Okay. So, are you experiencing any kind of sexual difficulty?
The difficulties would be definitely the pain with intercourse, because of the pelvic prolapse that I have, and the dysfunction. And then along with that comes the vaginal dryness, and then not able to achieve orgasm. Those are the problems that I'm having right now.
Okay. So, what about you? Excuse me. How do you feel about sexual fantasy?
Um, I think um, I think it's great. It's something that I think is good as long as I'm fantasizing about my husband. I would have a problem about anybody else, but I think it's great. I haven't really thought about that. I don't know if that could help my issues, but I don't have a problem with it.
Hmm. Okay. So, How do you feel about sex toys?
Um, I don't really know much about them. That my pelvic floor therapist has talked about them. She currently has me using it's called a TheraWand. It's something that I use for the tightness and the pain within the vaginal area, and it's used internally. So it's kind of similar to that, but it's not used during sexual intercourse or anything. So it would be something I may be open to if it could help my husband and I.
Okay. Okay. We're gonna look into that. So, how do you feel about oral sex?
Um, I I think it's enjoyable both ways. So I don't that doesn't bother me at all.
Okay. So, let's talk a little bit about your goals. So, I know you've explained all this, what is going on with you. So, what are goals for refraining um, therapy?
I think my goals would be to um be able to enjoy sex again, be able to hopefully somehow not have pain. And I don't know if that might be more on the medical side than on a therapy side, but maybe somehow working around that, and just overall enjoyment for both my husband and I, like it used to be. So, yes.
Okay. Okay, so how would you like to enhance your sexual fulfillment?
Um, I guess, and I guess enhance it by finding some ways to deal or cope with the pain, or I don't know. I just dealing with the anxiousness leading up to it, and um, I don't know, just trying to find some strategies to make things better.
Okay, that's good. So, thank you so much for giving me all of this information. Since this being the initial assessment, we're gonna continue to work on these things. But in conclusion, I want to let you know that I'm committed to enhancing your sexual fulfillment by proactively addressing any concerning areas of improvement. Is that okay?
Yes.
And in our next meeting, in our next section, we're going to look at exploring and experimenting activities and techniques that will enhance your sexual pleasure and intimacy. Does that sound good?
Yes, it's something I would be open to.
Okay, great. So our office is open Monday through Friday from 9 a.m. to 5 p.m. And our next session, before our next session, if you have any kind of concern or if you need to talk to anybody about uh, what you're experiencing, I would like for you to give the office a call
Okay.
with any form of question or concern. So do not hesitate. You can reach out to us. But when is your availability for our next appointment? We have Wednesday the 16th, and then we have Friday the 18th.
Uh,
Which day will be
Probably Wednesday, the 16th, would probably be the best day for me.
okay? Great. Okay, so I'm gonna go ahead and let them know to schedule that appointment for our next meeting.
Okay.
Okay.
All right.
Okay. Thank you so much,
Thank you. I appreciate
and have a
that.
great day.
You
I
too.
hope to see you again soon.
Yes, ma'am. Thank you.
You're welcome.
Bye bye.